and the family through medical care aspect of the nursing cure. Now, all these factors go on the specific levels wherein they are overlapping. If you could see the concept of the core, the care, and the cure, there are spaces where the care and the core are overlapping, and this has a very significant meaning for us. Meaning to say that the person or the nurse must use all these three aspects for us to be able to be a quality nurse, or for us to be able. Every after nursing theory, we see new concepts. Florence Nightingale presented that with the environmental concept, which until now we are using for us to be developing care for our patient in connection with the environment. Virginia Henderson presented the 14 basic needs of our patient. Faye Abdella gave us 21 nursing problems, and Lydia Hall gave us the core, the care, and the cure concepts. Right now, we will be focusing on another theory, thus the self-care model theory. Now, before that, let's now know the background of the theories. Orem was born at Baltimore, Maryland. She was the daughter of a construction worker and a housewife. She began her career at Providence Hospital, School of Nursing, and earned a BSN degree at the Catholic University of America. After which, she became the director of the same institution, then worked at the Division of Health at Indiana. Now, here we see the concept, or here we see the theory of Dorothy Orem. At this side, we see BCF, that stands for Basic Conditioning Factors. Orem said that every agency, or every will, that is, the patient and that of the nurse, would have a basic conditioning factor. Let's start, for example, for the nursing agency. The basic conditioning factor for the nursing agency would be the nurse should have competence, should have knowledge, should have all the necessary requirement for her to be able to develop, or for her to be able to see the deficits. We speak about the deficit, and we're talking about the self-care deficit of the patient. If and when the patient cannot take care of himself, this relationship, this line would connect the nursing agency to the self-care agency of the patient. At this point, okay, we see that there's no connection between, or there's no relationship, or this line has no direct contact with the nursing agency and the self-care agency of the patient, because the basic conditioning factors of the patient would say that if and when the patient cannot take care of himself, then the nursing agency is needed. As I've been mentioning a while ago, the nursing agency or the basic components, or the basic conditioning factors of the nurse competence, should have knowledge for this deficit to be identified. Once the deficit was identified, the relationship of the nurse agency would connect, or would have a relationship with the self-care agency of the patient and with the self-care demands of the patient. Now, the main purpose of the self-care agency is to assist the patient on the relationship, or on his or her agency. Okay, we see here a relationship and a direct relationship. It means to say that this relationship and the direct relationship connects the self-care agency and the self-care demands. It means to say that the self-care agency and the self-care demands of the patient would be the one that would assist the patient to develop his and or her own self-care. Okay? Now, there's again a very strong, or a very bold relationship, or a very bold connection between the self-care agency and the self-care, and the self-care demands and the self-care. It means to say that if this is working, okay, there's no need for the nurse agency to get into picture. But if and when this is not working, the dotted line would be solid, and the nursing agency would have a connection on the self-care agency and the self-care demands. Okay? Again, the value or the work of Dorothy Orem is to have the nurse assist the patient to develop his or her own agency, or self-care agency. And the contribution of Miss Evelyn Adam. Evelyn Adam was born April 9, 1929 in Lanark, Ontario, Canada. She's a graduate of Hotelview Hospital, Kingston in Ontario in 1950 with a diploma in nursing. Later on, she received a BS degree from the University of Montreal in 1966 and an MN degree from the University of California, LA in 1971. There she met Dorothy Johnson, who who she believed has definitely been the most important influence of her professional life. Dorothy A. Johnson is another theory which we will be discussing a little later. Her theory, or Adam writes that a conceptual model is an abstraction, a way of looking at something, an invention of the mind. A conceptual model for a discipline and its very broad perspective. It is also a global way of looking at a discipline. Basically, Miss Adam doesn't have any theory at all. Okay? Adam presented how conceptual models, or how important conceptual model is for a theory. Okay? Again, Evelyn Adam only presented with us on how to look at theories, and for us to be able to look at them, we should be looking at them as conceptual model. And this is the way that she have presented it to us. Okay. Relationship can be illustrated with a schematic flower. Each petal represents a distinct health discipline. For example, nursing, medicine, physical therapy, speech therapy, or nutrition. The center of the flower indicates the shared function, and each part of the petal is separate and distinct from the others, and the largest part of each petal represents the unique contribution of each discipline. Now, the petal that we're talking about here is this one. Okay. According to Evelyn Adam, these petals, or each petals, represent every discipline, or the multidisciplinary functions of every workers in the hospital. And the biggest part, or the biggest representation of each discipline is the science of its own discipline. The part that is shaded is actually the part wherein the discipline shares functions with another discipline. And this part, the center part, is where all disciplines are united to be able to attain a goal, or a unified goal. Now, we see now another theory. We're done with Orem. Okay, Orem again gave us the idea of self-care and the self-care agency, or how the nurse should be assisting patients to have his or her own agency to be able to take care of himself or herself. We had done with Evelyn Adam. Evelyn Adam doesn't really give us any theory at all, but she made mention of the conceptual models, or how conceptual models should be looked at. Now, we see another theory in the person of Madeleine Leininger. Part of 2003, we were very fortunate that these theories came into the Philippines and presented us her theory, which was developed at around 40 years ago. Now, basically, Miss Madeleine Leininger presented us the culture, care, diversity, and universality. Based on the transcultural nursing, whose goal is to provide care congruent with the cultural values, beliefs, and practices. Okay? This is also known as the Sunrise Model, which consists of 4 levels that provide a base of knowledge for delivering cultural and congruent care. Okay. Also, this culture, care, diversity presented us by Leininger gave us the modes of nursing. We have cultural care preservation, that help maintain or preserve health, recover illness, or face death. We have culture care accommodation, help to or negotiate for a beneficial health status or face death. And the culture care repatterning, help restructure or change lifestyle that are culturally meaningful.